Hello, I'm Sherry. I'm a patient at Team Healthcare and an employee, and recently I wasn't feeling well, so I had decided to talk to Dr. Tim to see if there was something we could do. I was having a lot of joint pain and I was tired. I was always a little bit more tired than I should have been. So Dr. Tim had me do a functional profile, which is a blood test that we do here at the clinic at Team Healthcare. So we did that, we ran it, and unfortunately, this was about 30 days ago, unfortunately the numbers came back and they were not good. My triglycerides were very high, my cholesterol was very high, my ferritin, which is my liver function, was very high, my fasting blood sugars were very high. So I went on a diet that we provide here at the clinic immediately, and we added a few supplements into my diet to help support my liver because my liver function was so poor. And we had determined that we were going to give me 30 days, and in 30 days I needed to make some changes. I needed to change my diet, like get away from the carbs and stay away from sugar and stay away from alcohol. So in the last 30 days I've done that, and I needed to include exercise because exercise was a big part of this too, because I hadn't been exercising on a regular basis. So I started biking, walking, hiking, using my treadmill with just 15 to 20 minutes at a time is all I did. I would go for an hour one time a week, and the rest of the times, maybe 3 or 4 times a week, 20 minutes. Not an excessive amount of exercising. And I went on the diet that we provide here, the dysglycemic diet, followed it pretty close to a T, and 30 days later I'm 9.5 pounds less, and my numbers are amazing. My blood sugars dropped into normal range. They were 111, they went to 90. My triglyceride, which is really important for liver function and health, heart health and everything else, went from 161 to 80. My cholesterol went from 216 to 190. So that is really good. And my ferritin numbers, this is the one that is the scary one. I actually had gone to an MD in between also, and we did a ultrasound on my liver to make sure I didn't have liver cancer. Basically what it's diagnosed with is I have like fatty liver disease, so I do have excess fat on my liver. And the number was at 387, I dropped it to 174. That's one I still need to work on. It needs to go down to about 148 or a little lower. That again is eating the right fats and staying away from processed food and things like that. So the numbers are all really good. Our blood work and comparisons at the clinic are amazing. You get little charts. It helps to be able to see where you're going. In 60 days from now, I will be doing this again. I'll be having some blood work done, and we'll go from there. So I just wanted to share it. It was and I did all this without adding any meds, because at this point in my life, when your cholesterol goes high, most doctors would just give you a drug to help that. I don't want to go the drug route if possible, so I went the natural way, and the natural way has worked. My cholesterol's in control. I see no reason why I can't keep that in control with what I've done. The changes I made are pretty easy. Sugar definitely was one of my biggest problems. I really cannot have as much sugar in my diet. It is causing body aches. It was causing me not to rest well, and it was causing my weight to be where it shouldn't be. So I'm hoping for good results coming down the pike. So, all right.